Hi, I'm Dr. Edwin Ozawa. I'm an anesthesiologist. I work at Albany Medical Center in Albany, New York, and I'm also the chair of the Mindfulness Affinity Group of the Society for Simulation in Healthcare. And I'm making this short video because I want to talk about something that is very important to me, which is the topic of mindfulness and its potential use in simulation as an adjunct for education. So you may be wondering, well, what exactly is mindfulness? You've probably heard that term thrown about quite a bit and are not really sure what it means. Also conjures up images of people sitting on mats, meditating in the forest, and generally sort of having a Zen experience. And while some of that is true, I'd like to talk about mindfulness in the context of it being a sort of deliberate practice. And my best definition of mindfulness is the practice of paying attention. Now, you can go into the literature and you can see all the different kinds of definitions that exist for mindfulness. But for me, that's a very short, meaningful definition that I often use when I lecture on the topic. Okay, so the practice of paying attention. Of course, the key then is to understand exactly what it is you are paying attention to. As you know, life is full of distractions, especially in the healthcare environment. We're on the computer, we're talking to patients, our pagers are going off, our phones are going off, and so it's very difficult to focus on one particular task. And so, again, in this environment, we're very much conditioned to be distracted all the time. And distraction can cause a lot of problems in terms of our emotional health, as well as our cognition and our ability to problem solve. So by engaging in mindfulness, what we're able to do is actually learn how to deliberately pay attention to what's important. And here in healthcare simulation, that's what we're all about, right? We're here about deliberate practice. So I think the concept of mindfulness really ties in well with simulation. So what do you pay attention to, you're asking? Well, those things include things like your emotional state, how you're feeling, the emotions of others, what's happening in the room, which we could also call situational awareness, and also attention to the task that you're doing at hand. So again, by deliberately practicing paying attention, we can improve our ability to shield ourselves from distraction, which can degrade the quality of our work in the healthcare environment. And so I just want to talk for a minute about what the evidence shows of the impact of mindfulness in the workplace. You may have caught the webinar that we gave last year on the topic showing some of the evidence, but there is sufficient studies to show that mindfulness can positively impact our health, our well-being, and how we interact with other people. So roughly there are 4 domains where mindfulness has been shown to demonstrate positive benefit. Those include cognition, emotion, behavior, and physiology. So in other words, mindfulness can positively impact how we manage our stress. It can influence how we communicate with people. It has been shown to positively impact our relationships with people in the workplace, and so that of course has implications towards teamwork. It has been shown to be associated with improved compassion and empathy, and of course in the healthcare environment that's extremely important. Leadership has been shown to be positively affected as well. And finally, there's this whole notion of deviance. Deviance is kind of an interesting subcategory, but basically there are 2 forms of deviance, positive deviance and negative deviance. Typically, people that are in the negative deviant category are doing things that undermine or hurt their relationships or how they operate, or even the functioning of their workplace environment or their teams. Positive deviance, on the other hand, is also a way of standing out, but it means that you are doing things outside of the box that are helping to improve all the domains of teamwork, leadership, and communication, and so forth, that are valuable in the workplace. And that is a key for innovation. which is something, of course, that we're really striving for in healthcare simulation. So I'd like to demonstrate to you one quick exercise which you could use at any point during your educational curriculum. This could be used to start a meeting, it could be used prior to the simulation, in between simulations, between the simulation and the debrief. It's a really good way for people to kind of collect their thoughts, de-stress, and focus on the task at hand. And so this is a simple breathing exercise. I do this often at work, but I also do it again during sessions where I teach and I feel that maybe things just have to be taken down a notch. So I'm using just a regular chair here, I'm sitting in it, and I'm gonna sit with my back straight. I'm not gonna slouch. I wanna maintain a good posture. We wanna have a good active posture so that the likelihood that we're gonna fall asleep is minimized. And basically I'm just gonna put my hands on my lap here, although if you like, you can also hold your hands in this manner, kind of folded together. If I have my hands on my knees like this is perfectly comfortable and I can keep my shoulders back, and it's very low stress for me. So to start this exercise, we're just gonna close our eyes and we're gonna take a couple big deep breaths. We're gonna take a big deep breath in through the nose. Hold it for a couple seconds, and then we're gonna exhale. And we're gonna take another deep breath in through the nose. Now hold that. And then we'll slowly exhale through the mouth. You can do these a couple times, just to bring your heart rate down and then also increase your relaxation. And now we're going to just focus on breathing through the nose. If your nose is stuffed up and that's really difficult, you can breathe through your mouth, but breathing through the nose is much more preferred. And as we're breathing, we're not going to force the breath. It's just going to be natural. You might think to yourself that you can't control the breath any more than you can control the waves on the beach. And just like with the waves on the beach, you're just observing the breath, the ebb and flow. And so paying attention to the breathing then becomes your anchor. You can focus in on the sensation of the breathing. You can feel your chest and your abdomen rise and fall. You can feel the sensation of the air passing through the nose. And as you're doing this exercise, you might find that your thoughts start to wander. You start thinking about lunch and the activities you have set up for the day, what the commute home is going to be like. And just notice that you're having these thoughts and gently bring yourself back to focusing on your breathing and the sensation of breathing. And if it helps, you can even use some words speaking to yourself. As you take a breath in, you can say to yourself, I'm inhaling or inhaling. And as you're exhaling, you can say to yourself, exhale or exhaling. So continue this exercise for a minute, or as long as you desire. Once your time is up, you can ask the participants to slowly open their eyes and bring themselves back to the present moment. So that about wraps it up. I'm glad to be able to give you some of this information today, and I hope you found it valuable. And I hope you will consider ways in which mindfulness could be incorporated into healthcare simulation. I think it's a really valuable and important tool, and something that's really needed in these times, of course. Thanks very much for listening. Have a good meeting.